Hi, I'm Dan Dotson, and this is Cyber Survivor. Over the past 6 months, I've had incredible conversations with frontline leaders, clinicians, and cybersecurity experts who face some of the toughest digital battles in healthcare. In this episode, we're looking back at the top 5 lessons learned, the stories that remind us cybersecurity is about more than data. It's about people, it's about patients, and it's about resilience. Lesson 1 comes from cybersecurity expert Phil Alexander. The most powerful defense comes from relationships, communication, and focusing on the fundamentals. He took us inside a ransomware recovery and reminded us that it's not about the latest shiny tool.
And I don't care if it's healthcare, what industry it's in, it's a CISO, CIO level, IT. This is my message I preach, and keep it simple. Do the simple things. Do the simple things. Stop doing the sexy stuff, like you said. Stop chasing the latest and greatest without doing the basics. Shore up the basics first. You're going to hit 90% of the preventions just doing the basics, and those are less expensive, by the way, than doing the sexy.
Lesson number 2, cybersecurity must be owned at every level of leadership. This is from episode 10 with Chrissi Maguire, President and Chief Executive Officer of the Mount Desert Island Hospital Organization. Chrissi shared what leadership looks like in the middle of chaos and the proactive steps her hospital took that minimized disruption and protected patients during a cyber event.
I think the most important thing is really start to immerse yourself in what is going on in the healthcare environment and how the appetite for our data is so sought after by threat actors and by nefarious individuals throughout the world, and that it is not going to be, and that isn't going to end at any point in time. You need to understand, first of all, why people or threat actors want your data, and what are you doing to ask those specific questions with your teams about how are we protecting it? How should I invest more information and awareness throughout the organization, but also with your board? The board has to understand their responsibility in this. And I shared that with our board. There's a white paper. The American Hospital Association wrote a trustees paper on it, and that was an eye-opening experience for our board to really hear that this is actually your responsibility. And then say, well, it's her responsibility. And so how do we ensure that? But those things are really cyber insurance. If you do nothing at all, get cyber insurance. Whatever you can possibly afford, because you're going to need it at some point. Invest in great collaborations and partnerships with known entities that have a reputation for being a partner and making sure that you're aware of what's going on and how to improve, and invest in penetration test, invest in making sure that your firewalls are secure, invest in white hackers, do the work, because if you want to maintain a sustainable organization and not impact patient care, you have to do that work early, and you have to understand that work, and you have to be willing to be a student of the work, because I'm certainly not an expert, but I'm willing to be a student and willing to go and invest time in understanding it more.
Lesson 3, people and preparation are more important than technology during a downtime. This was a conversation I can't stop talking about. Katrina Brown, Chief Nursing Officer at USA Health Providence Hospital, described unforgettable scenes during a cyber attack at her hospital. From nurses struggling to read cursive notes to cowbells being used as call lights, it was people and preparation that kept every patient safe during a month-long outage.
And so one of the first things that I came in to discuss was, and I had gotten in on a late Saturday night and came in extremely early Sunday morning, was rounding, getting an idea of how stressed the staff was, and already getting an idea of how many patients can they handle, how much staff do we need on the floor, how many patients can we handle in the hospital given the cyber attack that we were in. radiology was extremely affected. All of their reports were having to get pushed manually. We did find a way that they could read and record the reports out, and we had to find a transcription company that was off-site since all of that was electronic. But all those reports, getting them to the charts and so forth, was extremely manual. That was a huge limiting factor. Another limiting factor was in our lab and being able to get those lab reports back, which was extremely manual. It's not something that you're just going to be able to get the reports off of the EMR anymore, because you don't have an EMR. And so those reports were having to come manually to the floors. And so with those limiting factors of radiology, lab, and also that our inefficiencies were gone, and it didn't affect our ICUs as much because those ratios of nurse to patient ratios were already quite low. So we only had to put like one additional person on those units. But what we found is on our med surg units, our ratios had to go much higher. Particularly, our call light system was out as well. So we were passing out cowbells, and you really don't understand the inefficiency of a cowbell ringing until you're right there in the moment with a patient ringing a cowbell. And what they don't understand, they thought it was like their call light. You know, they do it once and somebody's going to come. When they rang the cowbell, you couldn't tell which room it came from. So the CNAs were having to go room to room to room to room asking, did you call? So the inefficiencies were real, and we had to do everything we could to provide a safe environment. My leaders had done a great and wonderful job at really setting the standards of our downtime procedures. You know, we had a really strong policy. I think the downtime policy was about 25 to 30 pages. It was a very strong, very detailed out policy of what we do with downtime. I don't think you can ever be ready for a cyber attack and to be down that long. But as much as possible, I could not have been happier with the leadership and what they had done.
Lesson 4. Every cyber incident is a patient safety event. In episode 14, Dr. Jeff Tully, co-director of UC San Diego's Center for Healthcare Cybersecurity, shared his research that shows how ransomware and system failures directly impact patient safety, and why evidence-based cyber practices matter as much as clinical protocols.
I think we're really interested in understanding the impact of patient outcomes that can come with technology failures. And technology failures is a pretty broad term, right? That can encompass ransomware attack, that could encompass a faulty software update that bricks, a million computers around the globe. And so understanding the way in which these dependencies, if adversely affected, then impact the care of patients, particularly patients with what we call kind of time-sensitive medical conditions. So things like stroke, heart attack, sepsis, trauma, right? Where the care really matters from the standpoint of how timely and efficacious it is, right? Certain conditions you can wait for your doctor to get back to you if you have a common cold or need a basic prescription filled. But if you have a heart attack or a stroke, the clock is ticking, and your ability to get timely care and the highest level of care is going to be directly impacting your ultimate outcomes. So a lot of our work is saying, hey, we know that we've seen media reports, we've seen a bunch of news stories, we've heard anecdotal posts on social media from patients saying that when they were in a hospital and there was a ransomware attack, it was very chaotic, very disruptive, right? Is there a way that we can start to measure or gather data about these topics in a way that really helps us understand the full impact, but then can give us some clues as to which interventions are most impactful from the standpoint of clinical resiliency and doctors and nurses taking care of patients, right? So I think it's important to kind of emphasize the perspective that we take is one of clinicians first and foremost, and view these technology incidents from the context of patient care and not necessarily as just something that's an IT problem. And so a lot of the work and the research that we do is focused on that. So just to kind of give you an example, there's not a lot of data out in the medical literature about patient outcomes associated with something like a ransomware attack. And so in 2023, we published some of that early data. And it's challenging to obtain that data, right? Number one, hospitals don't take it too kindly when random researchers show up and say, hey, you guys have just suffered an embarrassing, potentially devastating incident. Can you give us a bunch of sensitive data about what happened with that? But number two, a lot of the ways that we measure things like patient safety impacts, care quality, we leverage data that comes from connected systems like the electronic health record. And in a setting of a ransomware attack, that all goes away, right? And so even if you wanted to, even if you had a hospital that was willing to share a lot, there's sometimes it can be very challenging to actually get data that you can then use to make a hypothesis or examine a conclusion. So what we did in 2023 was kind of a unique and novel paper that looked at what happened to a hospital that was not affected by ransomware, but was in the adjacent vicinity of a system that was. So in other words, in a local regional area, there are a couple of different hospital systems. One of them was hit by Conti ransomware back in 2021. And we were able to obtain data from a system that was very close geographically that ultimately got a lot of the patients from that affected system, right? And so we looked primarily at data from the emergency room. We saw that compared to sort of the normal pre-ransomware period in this ecosystem, there were many more patients coming to the unaffected hospital to seek care. Patients waited longer in the emergency department. Many of the patients left without being seen at a rate that was higher than normal times. And then we also looked at sort of the overall emergency medical services picture in that geographic area. So when a hospital can't accept ambulances or helicopters transferring patients for whatever reason, that's called being on diversion. And the county system measures the total number of hours that all of the hospitals tell them, hey, I can't take your patients, and kind of tally that up. And we got that data. And we saw that during this period where one system in this ecosystem was affected by ransomware, the number of overall EMS diversion hours skyrocketed to a period higher than that even seen during COVID. So it was this paper, it was published in JAMA Network Open in 2023, that really helped us build this mental model of cybersecurity incidents like ransomware and other technology failures. They are sort of public health issues. They cause a regional impact. You don't have to be a hospital hit by ransomware to suffer from these types of incidents if it occurs in your larger geographic or sort of networked area. So that led us to kind of start thinking about cybersecurity incidents, other technology failures, really as kind of almost like natural disasters like earthquakes or hurricanes, and that they have this potential to cause widespread disruption. And when we think about resiliency, we really think about it in the context of how can we ensure that our weakest link is as protected as possible, right? Because one failure can cause sort of these cascading ripple effects.
To round out our top 5 lessons learned, we turn to Stephen Ramirez, Chief Information Security and Technology Officer at Renowned Health. Stephen walked us through the evolution of healthcare security, where governance and identity management have advanced, but the human element remains our greatest risk. From social engineering to insider threats, his lesson was clear. Cybersecurity isn't just technical, it's cultural and organizational.
If you have a strong governance process, it doesn't matter on what the new, if it's AI, if it's, something else that comes out, that's really the most important. So your intake to the organization, you have control on what you bring in, who you do business with, and then that educational process throughout the organization, and then having your GRC committee, operational compliance committee. So we have a lot of committees that involve, all of the key stakeholders on making sure that, we all are talking, collaborating, and people understand the risk of pieces coming in. So I think that governance is, even more paramount. And I mean, that's evident in NIST adding that to the new NIST 2.0. So you can have all of these different core things on, the protect, respond, recover, all of the pieces of that. But if you're not governing that, you're never going to get better.
These 5 real-world stories remind us that resiliency comes from fundamentals, leadership, preparation, patient focus, and culture. Cyber threats evolve, but lessons from Cyber Survivor give us a playbook for what truly works in healthcare cybersecurity. But the story doesn't end there. Hear new Cyber Survivor episodes every other Thursday. Like and subscribe now to continue to hear more from the frontline cybersecurity battles that shape our industry.